Hello, my name is Kana Kukushima from the George Washington University Cancer Center, and thank you for joining us today to learn about tools and resources to improve care and quality of life for cancer survivors. Our speaker is our very own Allison Harvey, Senior Manager for Healthcare Professional Education. For the support from the Centers for Disease Control and Prevention for this work, and we acknowledge the National Cancer Survivorship Resource Center, which was a collaboration between us, CDC, and the American Cancer Society. Mark, I would like you also to speak up. Please mute your phones when not actively speaking in order to reduce background noise. And please do not put your phones on hold. That may disturb the session with hold music or your organization's hold recording. We will unmute until it is time for discussion and questions. In order to broaden the reach of useful information, this webinar is being recorded, and it will be disseminated to CDC Cancer Survivorship grantees in Indiana, Louisiana, Kansas, Maine, South Dakota, and Washington State who may not be able to attend today's webinar. Finally, the raised hand feature on the right of your screen. If you would like to comment or ask a question, I can call on you. Alternatively, you can use the chat box or Q&A box on the right hand of your screen, and we can delegate those questions to our speaker. And with that, I will turn it over to Allison for her presentation.
Good everyone. It's a pleasure to be with you all this morning. Thank you again for joining us for this webinar. And so just a quick poll question before we get started. As you'll see that'll pop up. In which state do you primarily work? We'd just like to get a sense of who is on the call today. We want to Thirty more seconds, and then we'll move on. I apologize if you hear any construction noise in the background. They're doing work across the street, and so there's a lot of construction noise going on. But if you have any issues hearing me, please be sure to raise your hand or enter it in the chat box, and I will make that you can hear me. So it looks like everybody on the call at this moment is from primarily in Washington State, so that's good to know. And again, as we said, that this webinar is being recorded for other cancer survivorship grantees as well, and will be distributed to them as well. But thank you for the participants that are able to join us today. So brief learning objectives are to describe current trends in cancer survivorship, discuss the need for cancer survivorship care, explain characteristics and learning outcomes of the Cancer Survivorship E-Series. So other little brief poll questions before we kind of proceed again. You can see these are 3 questions. The first question is, how familiar are you with survivorship care and the needs of post-treatment cancer survivors? The second question is, to what extent have you participated in the Cancer Survivorship E-Series? And the third question is, have you shared the Cancer Survivorship E-Series or specific modules with others? So we'll just pause here just to get a sense of, again, who's on the call and how familiar you may be with the topic areas that we're covering. And if you're not familiar, that's okay. And if you are familiar, we'll look forward during hear your experience during the discussion portion of today's webinar. Okay, great. So it looks like people are somewhat familiar with survivorship care and the needs of post-treatment cancer survivors. For the E-Series, people have either heard of it or are not aware of it, and then some have shared the E-Series and others have not. So that's good. So I think today we'll be kind of covering a lot, and hopefully you'll be more familiar with all of these areas after today's call. Just a brief background before we move more into covering the E-Series. It's currently estimated that there are about 15.5 million cancer survivors living in the United States today, and this number will continue to increase. In recent years, there's really been an increased focus on ensuring coordinated care for survivors to address needs of post-treatment survivors. And we also know that post-treatment cancer survivors are at an increased risk for a variety of issues, including long-term and late effects. And we'll cover those a little more in just a few moments. Active cancer treatment. So depending on, some people may only have surgery, some people may receive a whole host of different types of treatment. So each, treatment has its own specific side effects, both short-term and long-term. And then there are also non-treatment specific side effects, which we'll cover as well. But these all impact the individual, their risk for cancer moving forward, and also their quality of life. To briefly illustrate the kind of the impact that cancer has on individuals, I wanted to just play two brief audio clips. These are actually excerpts from the interviews that are included in the e-learning series. And so I think this kind of really helps set the stage for what some people experience after treatment. So first I'm going to play Kristen's brief audio clip.
My trip was supposed to be 12 rounds for 6 months, but it did go longer due to the toll that it took on my body. The effects that I experienced and continue to experience is chemo brain, neuropathy in my feet, and just general fatigue. Life and activities after complete treatment has changed a lot also. Physically, I get tired even after working day at the office. It's hard to walk on uneven ground such as grass, gravel, or sand. And mentally, it's probably the hardest. There's been bouts of depression and, of course, the anxiety of return of cancer. I wanted my life to be normal after cancer, but definitely having to live with the new normal.
I'll play a brief excerpt from Sam's experience.
Well, fortunately, radiation therapy and now the primary treatment for somebody with a stage 3 squamous cell cancer of the base of tongue that's small like this would probably be chemoradiation. So they would have chemotherapy as well as radiation, but they'd have reduced amounts of radiation. In my case, in the day, the standard of care was twice-a-day radiation. But that really created a tremendous problem for the head and neck structures then, which caused tremendous pain and swelling, difficulty swallowing, lost taste, loss of saliva, which I still suffer from. But it also created tremendous skin changes and difficulty with my neck, not only then, but even to this day. It creates a lot of hardship. There's probably no place in the body that reacts so dramatically to radiation and chemotherapy as the mouth, and that's just because the mucous membranes of the throat are so sensitive to radiation. Fortunately, that makes it more successful, but unfortunately, it also creates lots of problems.
So I think those are really poignant excerpts, and I think really, again, touches on the needs that cancer survivors have and the impact on their quality of life. So as you heard both for Kristen and Sam, you know, there's the impact on the physical well-being, impact on the psychological well-being, and really probably also, you know, impact on social well-being and spiritual well-being. So we can kind of think of these as being kind of broad domains, and here you can see examples under each. This isn't meant to be a comprehensive list, but really just to give you a sense of what the impact of cancer beyond treatment can have. So, for example, for social well-being, many people may experience changes in relationships with their families or loved ones. And also, as Sam touched on, for him, there was a change, both a change in physical appearance, but then that may also impact how he is perceived by others. And so, in thinking about as cancer survivors move out of oncology care and back into primary care, there's really primary care providers play a really important role in continuing to follow up and care for post-treatment cancer survivors. So it's not really very different from roles that primary care providers are already used to having. So really, primary care providers ideally should be promoting healthy behaviors to cancer survivors, assisting in the surveillance for cancer recurrence and second primary cancers. We do know that cancer survivors are higher risk for second primary cancers, and also assessing and managing physical and psychosocial long-term and late effects. So kind of some of the things that we just touched on, being able to assess for those and then referring out and making sure that those needs are being met. And then also clarifying care roles as needed with other members of the cancer treatment team. So before I talk, give you kind of a tour of the e-learning series, just to broadly say, the e-learning series was launched in 2013 to really help primary care providers have a better understanding of the needs of post-treatment cancer survivors and the role that they can play in their care. And so there's been actually beyond the United States, as you can see from this map, there's been quite a large reach with more than 86,000 people visiting the site, and from more than 130 countries, and all 50 U.S. states and D.C. have visited the site. Currently, more than 4,000 learning modules have been completed, and approximately 3,500 have been started. So now I'm going to share my screen. So let's just pretend that we click on this link, and then we go to, you would be taken to, as it changes over, taken to this landing page. And so this is the landing page for the Cancer Survivorship E-Learning Series. So again, it kind of tells you a little bit about the modules and continuing education credits offered. But to actually access the series, you would need to register, create an account and register. And then once you've done so, you would enter the enrollment code PCTRAIN. And so then that would give you access. Again, the course is available to everyone at no cost, and just by entering that code, you would be enrolled in the course. So let's say you've created an account, registered, put in the code, and so then you would have access to the Cancer Survivorship E-Learning Series. So this is actually kind of a back-end view of what it would look like when you log in. The one thing I will note, so you would have ability to access all of this information, but we do ask that all learners just complete a brief survey, and then after which all of the modules would unlock. So these actually, since we're kind of doing an ungated review, we can move through the series, but you wouldn't be able to actually access any of the content until you complete just a very quick survey. So here you can kind of just see some of the things that we're interested in, and then also help us with evaluation and understanding the reach of our program. So again, it's 10 modules. You can take them in any order. Each module can be standalone, or if you wanted to start at module 1 and work your way through all the way to module 10, that's fine too. Or for example, if you are primarily breast cancer survivors in your clinic and want to know more about the guidelines and the long-term effects, that you can just take module 9. And so each module has a brief assessment, which just covers, confidence around around the learning objectives of the course. And then a brief, we just listened to a brief story from a patient about their experience with that type of cancer, and then a presentation by experts in the field. So Dr. Gans presenting on the long-term and late effects of breast cancer treatment, and then Dr. Chang presenting on the guidelines for primary care providers. And so what I should say is really modules 1 through 6 are they're very broad. They give a very broad overview of cancer survivorship and cancer survivorship care, while modules 7 through 10 really focus on the guidelines that were released by the American Cancer Society for primary care providers. Any questions before about the e-learning series or the structure before I kind of move on to how we've evaluated the e-learning series? Okay, with that, I'm going to stop sharing my screen and continue on. So, to preface this, some of this data has been presented most recently at the ASCO Cancer Survivorship Symposium. So we have evaluated the e-learning series. And so from October 2013 through October 2016, we've looked at 730 participants, either oncology providers or primary care providers who participated in and completed a portion of the e-learning series, whether that was the entire series or just one module. And here you can see the type of analysis we used to analyze the data. Briefly, a little bit about the kind of the learner demographics. So you can see to date, it's primarily been oncology providers that have participated in the E-Series, and then primary care providers. The majority are female, but I think it's important to note, particularly for physicians, that it has been, out of primary care providers, a third have been physicians, while in oncology, it's been more nurses, which makes sense at the same time in that nurses and the role that they play in oncology and survivorship care. Nurses are heavily involved in that area. So we looked at, so as I mentioned, we ask a little brief pre and post assessments around confidence of the learning objectives. So here you can see from modules 1 through 10, the pre and post means of primary care providers. Again, it was asked on a 5-point Likert scale. So you can see that confidence, most primary care providers were kind of in the 3 or 3.5, so neutral range. But then after the completing the e-learning series, indicating kind of 4 or higher, due to the lower sample size for modules 7 and on, we weren't actually able to test for significance, but we did see statistically significant changes across modules 1 through 6 for primary care providers. And for oncology care providers, again, it's very similar to primary care at pre and post, in that most oncology providers in the neutral area in confidence, but then after, again, kind of very similar at 4, slightly higher. Since a larger sample for the oncology care providers, we did see statistically significant changes from pre to post across all modules. We also did look at comparing kind of the change scores between primary care and oncology care providers. And so what we found was that for primary care providers, they had a statistically significant change in confidence around being able to describe common late effects after treatment compared to oncology providers, which again isn't surprising in that oncology providers may obviously be more familiar with the long-term and late effects of cancer treatment. While there was a statistically significant change among oncology providers, being able to explain the primary care provider's role in providing survivorship care focused on prevention, wellness, and screening. So, which I think is a good thing in really understanding for oncology perspective of what the role of the primary care provider is and how both providers from both sides can work together in meeting the needs of treatment cancer survivors. Is the e-learning series effective? Yes. We are still, though, continuing to do ongoing evaluation, but we did see positive learning gains among both primary care and oncology care providers. For most learning objectives, there was statistically equivalent gains from pre to post. And so we, would like to say that the e-learning series is effective in improving confidence around meeting the needs of survivors and engaging in recommended care practices. However, there is a need for continued dissemination among providers, particularly those in primary care. So again, our hope today is with this webinar that you will be interested in potentially participate further in the e-learning series, learning more about the needs of post-treatment cancer survivors, guidelines available to help guide the care of post-treatment cancer survivors in your practice. So the guidelines were released by the American Cancer Society, and you can find them here. They're also available in the learning management system, which I did show you earlier. We also have, in addition, the National Cancer Survivorship Center Resource Center Toolkit. And so this toolkit is a great resource both for patients and providers. It provides a short, summary for providers about the long-term and late effects of the cancer treatment for the particular type of cancer, again, prostate, colorectal, breast, and head and neck. And it also provides a brief summary of, what primary care providers can do, whether it's referring out or, an assessment for the patients. And then it also provides resources for patients. So an overview of some of the things patients may be experiencing and also a checklist so that patients can use that when they come and visit with their primary care provider, to help them really be prepared to talk about maybe some of the things that they're experiencing. Just briefly, the references for this presentation. And I'll conclude that with a thank you. Thank you for joining us. And again, here's the link for the e-learning series. And now I'll open it up for if people have any questions, would like me to go back to any slides. Happy to do so. Go back and share my screen for the e-learning series if there's any questions.
For those of you who are joining us by WebEx, you can either use the raised hand feature so that we can unmute you. For those of you who have joined just by phone, I believe we can go ahead and unmute everybody. If you don't have an intention to speak, please go ahead and mute yourself so that you don't disturb the connection here. So I believe there's somebody who has not muted their phone, so we can hear a little background, maybe somebody in a car.
So we do have a question. Says that there are limits on who can do the e-learning modules, non-physicians. So no, there are no limits. The e-learning series is open to everyone. We do offer continuing education credits specifically for physicians, nurses, and certified health education specialists. But I think, again, if you're out in any of those kinds of professions, if you're a community or licensed for those where we're offering continuing education credit, whether a community health worker, a patient navigator, anybody really working in the healthcare professional field with post-treatment survivors, there is a lot of relevant information for you. So I think that's something to keep in mind. And then the second question is, what modules are most frequently viewed? So at this point, as I mentioned, the e-learning series was launched in 2013. However, the modules rolled out over the course of several years. And so the head and neck module was the most recent module released, and that was in 2016. So we have the most views of modules 1, 2, and 3, so really around the current state of survivorship care, kind of the long-term late effects of cancer and its treatment and managing comorbidities, and then also on the psychosocial health needs of cancer survivors. And so those are kind of, but then I think that's more due to time of that they've just been available longer. And you are able to download and access the slides in the learning management system in addition to actually listening to the presentation. The slides are available in the resources section of the LMS, and we also provide additional resources for the, module that you may find relevant to help. Any other questions? Okay. Well, that, I think, unless you had any other comments, I think we can close. But before we do, let's do the evaluation. So we do always like to evaluate our webinars. And so if you could, you'll see a brief evaluation. And so if you could participate in that, we always do appreciate your feedback and always looking for ways to improve. And so that you should see that poll pop up. And so if you are on WebEx, please go ahead and fill that out. And then the session is being recorded, and we will make sure it's distributed widely so people can learn more about the E-Series. And thank you again for your time and participation.
For those of you who are just joining us on the call, I may not be able to see the slides. The link to the e-learning series is bit.ly/PCP e-learning. And we will, again, make these slides to you so you can go back and look at the slides yourself, access the bit.ly to go to the PCP e-learning series. Let's see Allison Harvey's email address, so if you have any further questions, you can reach out to her directly. Thank you, Allison, for a wonderful presentation, and please do make sure you fill out the poll on the right hand of your screen. We hope it was helpful for all of you to see the current trends in cancer survivorship and the crucial position that many primary care providers and those working in oncology to support survivorship care, as well as the contents and measured effectiveness that we've assessed in the Cancer Survivorship E-Learning Series, delivering continuing education on survivorship to primary care and oncology providers. Again, we will have the webinar recording and slides to you, so please feel free to share with your colleagues, and we will leave the poll up for a few more minutes, but thank you for attending the webinar, and we hope you enjoy the rest of your day.